Hey guys, Danny Gustin here with the Danny Gustin Fitness Podcast. We've got Dr. Joe Agostinelli on today. He's back. Guess who's back? Back again. Business name?
Adapt Health and Wellness here in Naperville.
I had you do it this time because the last time I did it didn't go so well. So
Sorry.
So yeah, Dr. Joe is on here today to explain the beef between chiropractors and physical therapy from his perspective as a physical therapist. We learn a lot about just kind of the different paradigms there, how they both fit into the physical medicine paradigm, as well as, you know, a little bit of Dr. Joe's perspective on things like acupuncture and massage therapy. So I learned a ton. I think you guys are going to enjoy this one. So if you do, like, subscribe, and we'll see you next time. Well, Dr. Joe, thank you for coming on.
Thank you, Danny. Good to see you, bud.
So you know what we're going to talk about?
I
This
do.
is something that's come up in other podcasts before. We've had you on and another PT on, and I've known a lot of PTs over the years, and this topic has come up.
Sure.
And I'd love to just kind of get your insights on it. So that is the beef, right, between PTs and chiros.
Sure. So I always want to preface this conversation by saying that I come at it from a bias because I'm a PT, and especially a manually trained one. So, my perspective is going to be skewed that direction. So certainly in the future, if there's ever a chiro who comes on and wants to talk to you about it, be curious to see kind of what their perspective is. I kind of joke about it being the Mad Men theme where I think about chiros all the time and they can't even bother to be thinking about me. I have no idea. So I'm not really sure what kind of the opinion of that side of the sort of the MSK spectrum is.
Yeah.
But I can speak for what I know.
And MSK, musculoskeletal?
You got it.
Okay.
So, I think, the reason we say beef, I suppose, is that I think over the years, as specialties have gotten more advanced, more education has been involved, you're starting to see kind of a merging of those two professions where there's a lot more overlap in what they can do versus maybe 15, 20 years ago. I think a lot of people who had chiropractic care back then probably know it as you go in, you get popped, you get some stim, you get some heat, whatever other modalities, and you walk out the door.
Yeah.
Whereas PTs, you walk in, you get some bands, you get some stim, you get a little exercise, and you walk out the door. And so those streams were pretty separate. And I think over the years, as some research has evolved, the desire for PT to become a bit more autonomous has improved. I think, again, the way that the chiropractic model has sort of responded to some different research in what's appropriate patient care, those are starting to push closer together. And so inevitably when that happens, there's a turf war, right? Like who's best to treat patients for certain conditions? And so a lot of times, at least in my experience, a lot of those battles are fought like state legislature levels because a lot of times what certain professions can do varies state to state based on what the charter allows. So, we talked, I think, one time I was on here about how you can come to a PT directly without a referral from a physician.
Yeah.
That's pretty new in Illinois. That's only about, I think, 5 or 6 years old, and that takes rewriting the Practice Act for the state and for, the legislatures to approve it, for the governor to sign it, for that to become law.
Okay.
And different states allow for different things. So if I remember reading correctly, in Alabama just last year, they approved direct access, but they rescinded the right for PTs to order images. Okay. And my feeling, this is speculation, my feeling is that was some sort of relinquishment of the right to perform things based on certain lobbying groups saying, hey, if you try to push this bill, we're going to oppose it unless you give us this. Kind of those handshake agreements in the back deals as to how politics works. We live in Illinois.
Yeah.
Some dirty politicking goes on sometimes.
Yeah.
That's my suspicion is what happened. But I think because these professions are smushing closer together, there's now a little bit more butting heads of who gets to do what.
Yeah.
In my opinion. So, I think in terms of when I think about what the turf war looks like, I look at, what do people expect when they see a chiropractor, when they see a PT? And as a manually trained PT, a lot of my patients come to me and I think they feel...
Can you define what a manually trained PT is?
So it's extra education and certification doing different joint techniques. So mobilizations, manipulations of the spine and of all joints of the body. So when you're in PT school, you get a smattering of it, but PT encompasses a lot of different specialties for pediatrics and geriatrics and women's health and so on and so forth. So chiropractic tends to be a lot more MSK, musculoskeletal driven. So that's kind of part of the base curriculum for that whole profession.
Yeah.
Whereas in therapy, it's a bit more of a subset of everything else.
Yeah.
So if you want to be in the orthopedic world and open up in a gym like I do, or work for a big PT company in orthopedics, you can endeavor to seek more of that education in manipulations of the spine and other peripheral joints. That would be manually trained therapists.
Okay.
And there's a whole host of different specialties and groups and folks that you can seek that out from. But anyway, so when
and PTs call that's an interesting one, right? Because PTs call manipulation,
sure,
right? And,
yes.
And it's I think the way you would explain what's happening is a little bit different. Whereas a chiropractor, a lot of people who have met with a chiropractor would say, manipulation? Isn't this an adjustment?
Right.
Right? What would you say is the difference? Because a chiropractor would do something to kind of maneuver the spine if it's subluxated, right, or whatever, right? Where the PT would manipulate, right? Or did you say there was a different word?
No, it's
manipulate.
Exactly. So I think patients it feels the same. Like I've had patients who have told me, "Oh yeah, you're going to adjust me," and I say, "No, I don't. That's not my word."
Yeah.
And I think it probably comes back, Joe's opinion, comes back to a thought process of what's the goal of the technique. And I think because so much of the chiropractic model of care for the spine involves on improving misalignments, I think the verbiage that you're adjusting back to where appropriate alignment is. And we can have a long discussion about my feeling is sort of the use of that word, because I feel like that the language is a little dramatic when you tell a patient that their spine is misaligned.
Yeah.
But I think that's probably where the verbiage changes. But I say manipulation because in my training and in my world, when you apply a thrust manipulation, it basically means you take a joint to the end range, you apply a quick thrust, you get that click, what we call a cavitation, to basically stretch that joint beyond its end range. It goes back to its range again, and then that's the technique. All in all, whenever you hear a joint click, that's essentially what you're doing. You're getting that cavitation, which is a release of air in the joint, and the joint restores back to its normal positioning.
Okay. And so you say it restores back to its normal positioning. So what is the distinction between how you view it and a chiropractor views it?
So in my feeling is that, when I tell people I'm going to do this technique, my goal isn't to say that this joint or this segment or whatever word you want to use is in a place it shouldn't be. Okay, so my world is I get a sense if I see you move, a certain direction. And again, I'm speaking specific to the spine, but this can be anywhere in the body. I manipulate elbows, I manipulate ankles. Those are all in play.
Yeah.
But, when you do a movement assess of a joint, you put your hands on someone and you get a sense of when you move the joint, what do you feel? Do you feel like it moves normally? Do you feel like that there's a restriction or a firm or a jammed end feel where the joint just stops going? I can say based on what direction is stiff and how it feels that this might be a joint that's sort of ready to be manipulated. So again, we try to apply that stress in the direction of movement that's stuck to get that moving again.
Okay. So if I could summarize that in layman's terms, it's almost like you're saying the chiropractor would say that because it's misaligned, that is the source of some of these issues, right? And we need to correct that misalignment to start addressing some of the symptoms, where you may be looking at the manipulation as just one piece of the puzzle, and that you've determined through your assessment that restriction in how the joint is moving is going to affect the rest of the chain in a way that could lead to dysfunction.
Yeah, I think that's a nice succinct way of putting it. And so I always describe that technique as a vehicle for further movement.
Okay.
Because what we've done is we've allowed for the joint to be more ready to move again. So we need to suggest to it that, hey, you've been living in this position. That position isn't working for you for XYZ reasons.
Yeah.
So sometimes we can't overcome that with just regular old stretching or with a more gentle mobilization, which is not applying as much stretch to the joint. And so we need something a bit more, I'll use the word dramatic, to try to influence movement that then you can then exercise with or stretch through a little bit more easily.
Okay.
So
okay.
I and again, because I'm speaking from one side of it,
Yeah.
What I can tell you what patients say to me is that their perception when they hear that that my spine is misaligned is that my segment was put back in place or my disc was put back in place. And again, I find that language to be a little dramatic, because I think whether it's the thought of like someone really is in a position of dysfunction, or maybe that isn't the intent. It just might be how healthcare people speak in their head versus what a patient actually hears.
Okay.
But when you tell someone that, it feels like if I have my segments of my spine, that my spine is over here somewhere.
Yeah, you're like,
right.
Yeah, I could see that.
And I've had patients who've had, lumbar or cervical fusions of the spine who've had sort of this micro shearing because the fusion didn't set. And we're talking teeny little bits of movement, and they're in agony. So the thought to say that the segment's all the way over in one direction is, again, I think it sort of overplays what we're actually doing when we're applying these techniques.
Yeah, hence the word dramatic.
Yeah, exactly. So, I think when I really kind of struggle over when I work with these patients who maybe are also seeing chiropractic or have seen them in the past, I think there's two different avenues I sort of struggle with. And the first one is sort of what's the intent of the manipulation? And then what's sort of the business models of the two professions that we're sort of butting up against? Like, how does that sort of fold into the overall kind of ethos of what these medicines are trying to achieve?
Yeah, and would you say it's true to say that both chiropractics and physical therapy are part of the physical medicine paradigm?
Yes, for sure.
Right? Also things like massage therapy, acupuncture, right? Those are all things in that paradigm, right?
Yeah.
And so do you think there is a role, or objectively, what is the role of chiropractics versus the role of PT in that paradigm?
So if we're talking about a provider who's applying thrust manipulation to a joint, they both have a role if that technique's being used, again, in my opinion, in a way that's sort of appropriate and research found. Okay. So, I always give the description that manipulations are chisels and they're not hammers. If they're used very specifically in specific instances for a goal, there's some benefit there. If they're used to sort of treat everything, you're basically you're over applying the medicine. And so what the current research suggests, and I'm going to speak again mostly for spinal issues because that tends to be where there's the most sort of bickering back and forth on it, is that in acute cases of pain, there is some indication where a thrust manipulation to the neck or the back does have some efficacy for being helpful as part of a comprehensive program of rehabilitation, which you can include other passive modalities, but really the basis of it is movement-based therapies. Exercise of some component.
Yes.
So when they've done research on thrust manipulation alone versus thrust plus exercise, the thrust plus exercise is much more superior versus just thrust manipulation.
Gotcha.
But in those acute cases, where someone tweaks something and pull their back or something happens, there is, if properly applied, there is some efficacy to say, hey, this technique should be effective for you.
And to be fair to chiropractors, in that particular example, you got a manual therapy license or certification that was extra. Right? Whereas, would it be safe to say that the average chiropractor would be more equipped to apply that manipulation or adjustment under the right circumstances than the PT fresh out of school without any certifications or licenses?
That's a fair statement because, again, that's part of their base, kind of the base curriculum for chiropractic is the manipulative sort of treatment. Whereas most PTs coming right out of school may have learned a technique or two, but it's not as ingrained into their education.
Yeah.
And also, chiros, there's a lot of different schools, for chiropractic medicine. I mean, last time I checked, there's like 8 or 9 different subspecialties. So some patients have gotten...
I didn't know that.
Oh, yeah. So some patients have gotten... I think most people think about someone grabs your head and sort of turns and it makes a noise. You see that on Instagram all the time now.
Yeah.
That's probably the most common one, but there's also the drop table method where they actually use the table sort of drops in place when they apply a thrust. There's activators where they use a little kind of plunger device to apply that stress.
I've seen both of those.
So there's a lot of different mechanisms, but it's all sort of towards the same goal of creating that thrust technique. But yeah, coming out of school, if you took a fresh new grad PT versus a fresh new grad chiro, the chiro was more trained at that moment in time to apply a manipulation versus the PT, just based on what the emphasis of education is coming out of school.
Interesting. Yeah, because one of the best chiros I've ever worked with, and I've shouted out to him before, his name is Brady McDaniels. He's an elite recovery chiropractic in Naperville. In many ways, he seemed just like a physical therapist to me who had a specialization in the spine, right? That's but I don't think he adjusted me. I maybe saw him eight times.
Yeah.
And I think he adjusted me one time. And for the most part, outside that, it was uses like electric stim, stretching, manual therapy, and some exercises.
Yeah.
But to your point, you mentioned one of the things that you've had a beef with is the business, right? Like, how do they approach it from a business standpoint? And I've also been to that many chiropractors over the years, a lot more 10 years ago when I was younger as now, but where I've been to chiropractors where this one guy he'd have everyone sit on a massage table while they're in the lobby and then adjust them and then leave.
Right.
And that was the thing. You lay on the massage table while you're in the lobby, you get adjusted, ba-boom, ba-boom, ba-boom. I've seen many where you have stations where you get on a wobble board, you get on some sort of foam block and just kind of sit there, or maybe you have actual traction mechanisms, and then maybe you do something else, right? But the impression I got going through those versus going through Brady's, the way he operated his business, felt very cookie cutter, right? Like they were basically just going to do some cookie cutter protocols and then adjust. Yeah. That seemed to be the gist of it. And in some ways, I could see why that would be a good business model, right? You tell people over and over again that they need to come in X amount of times per week, and maybe eventually that turns into a maintenance plan, but you just keep doing that, and you always need to do that because if the spine, like to your point, if the spine gets a little out of whack, we can always get it back where it needs to be, and then you'll be good as new, almost like you're a car that needs to go into the shop every so often, right?
It's funny, I use that exact analogy, because when I tell folks, if I take my car to a mechanic and, and every 1,000 miles, I burst a tire, and then I take it to the mechanic, goes, well, just bring it back every 1,000 miles, I'll just keep changing the tires for you. Okay, I would prefer someone tells me, maybe stop driving like a schmo so you don't keep breaking your car, and then I don't need you anymore. Yeah. And I think that's where I struggle the most is that, in the verbiage of, just come back and I'll fix it for you. I think it's once you're taking ownership of the issue away from the person, I think that instills something in someone's mind where they feel like that, well, this is just a thing that happens to me and I need someone to sort of get it back in place. And we spend a lot of our day trying to empower people to move on their own and feel more confident in their own body and try to measure their own pain levels and learn how to work through those things, because we're trying to empower people to be independent and active in their communities. Yeah. And so I struggle with this concept of, well, just come back and see me. I'll take care of it for you, no problem. Yeah. And I think that's the model where I push back on it, because I don't feel like that our responsibility in this medicine is to put you back together. It's to show you the exit ramps. You don't have to see me anymore. Yeah. And certainly, if someone wants to come back and see me every 6 months just to sort of review their exercises and make sure they don't have any questions on something, that's fine. Yeah. But that doesn't involve me putting my hands on them whatsoever. Yeah. Right. So, that's where I think that business component comes in. Is what does the medicine and the research say? Yeah. Versus sort of what's the practices being put into place. And so, the example of what was his name? Brady
McDaniels.
Yeah. I think that's a sign of where, again, you have those turfs starting to push up against each other. But, I also have to put my ego aside and say, okay, even though I'm a PT, if this is the kind of medicine that's being practiced out there, I think this is an appropriate plan of care for a patient. If folks get better with that mechanism, fantastic, right? Yeah. We're all in a position. We're all endeavoring to make sure that people get healthy, right?
Yeah, and I think you'd like Brady in the sense that, like you said, hey, I want to help you, and when I'm done helping you, then spread your wings and fly, right? Mm-hmm. He's very much that way too. He's not, hey, get in here 3 times next week. It's more, hey, when can you get in here next week? And let's figure it out. You get the treatment you need, and then he'll be the first to say, all right, man, like I'll look forward to hearing how the wife and kids are in a year or two from now, right? Where to your point, maybe in some cases it's more so like someone sees you in 6 months, you sit down and you say, hey, what's going on? Let's you may come up with that treatment or whatever for the day in that moment based on their feedback, where some other business models in chiropractics may be, no matter what you say when you come in today, I'm going to adjust you, and I'm going to do this, and that, right? And so it's almost like an overreaching of the efficacy of this one particular tool at times.
Yeah.
Right?
That's the hammer we're talking about. Like, let's just sort of, use it on everybody, because it's going to be, this must be what you need, right? It's the thing that you're most equipped to do, which I think every person falls into that trapping somewhat, is if you're trained to do this specific thing the most, you want to do that thing.
Yeah.
Because that's what you feel most comfortable doing. But you also have to remember there's times where it's not appropriate.
Yeah.
Right? And that's having that thought and that bravery to say, okay, even though I do this thing the best, it's not the thing you need right now. Let's focus on the other thing.
Yeah, and this is my experience. Maybe you can kind of fill in some of the blanks, but you just mentioned that the PT's got the ability in the last 5-6 years to just refer, basically to take patients on themselves without having to be referred to a doctor in some cases, right? Depends on the insurance to an extent, right? Would you say some of the butting up is potentially related to historically chiropractic is more cash based, and so people may have been going to chiropractors in instances where they didn't necessarily want to go through the whole rigmarole of going to the doctor, and they could just go to a chiropractor, maybe whatever modalities and protocols were being used, they'd get out of there with some relief, some pain management, where, again, pre 5-6 years ago, the idea of seeing a physical therapist may have been something like, all right, my knee's bothering me, I got to schedule an appointment with my doctor, and then he's going to determine what's next, and then I got to figure out what's the deal with this physical therapy place and then get evaluated. So there's almost more friction between getting that relief you're looking for the person who just wants that relief now. Whereas now people can do more of that, whether or not it's cash-based or not. You could just go directly to Dr. Joe instead of going to see your doctor if your insurance allows for it.
Yeah.
Right? Do you think that is maybe where some of this came from, in that there's been more flexibility on the part of the chiropractor to treat?
Yeah, I mean, that profession's had more autonomy than therapy has, for a number of different reasons. Whether it's the doctor designation, because PTs were only got their clinical doctorates probably en masse. I think 15-ish years ago, where it became more. Most PTs now have that because that's all you can get coming out of school. But when I started school, I was in a master's program.
That's right.
So
that was the early 2000s, right?
Yeah, I started in 2001, exactly. So I think that was probably part of it, is because that doctor title, it says a lot to a patient, right?
Yeah,
When they say, I'm going to go see Dr. So, and without maybe thinking about what does that mean exactly, right? What does that doctor label entail? Not to diminish someone who earned it, because anyone who goes to school that long has earned that title.
Yeah, no doubt.
As long as they use their powers for good afterwards.
Yeah.
But that's why PT pushed for that designation, and why part of that was becoming first provider, appropriate first providers, which is screening patients for making sure that their medicine is appropriate at the time. A lady came in yesterday, and she said she was having pain between her shoulder blades. And I said, well, do you have any shortness of breath? Do you have any problem getting to the parking lot? And she goes, no. She goes, why'd you ask me that? I said, well, pain between your shoulder blades in females is a sign of a heart attack. So you got to make sure that you don't have. I have a cardiac event in my clinic before I decide to start stretching your shoulder, right?
Yeah.
Like, you have to be trained on that stuff.
I would have never known that.
Well, that's why you go to school for fun.
Now I'm gonna be keeping an eye on that.
Not to say everyone with pain between the shoulder blades having a heart attack, but just take their pulse. Yeah. But I mean, that's the sort of thing that you get trained on. And that's part of what earning that doctorate does. And I think that maybe this is coming a bit more to the forefront again now that the level of education for PTs has gone up. More of these PTs are getting training that's akin to chiropractic. And I think what people expect from these different professions has also changed, because I think for a long time people sort of assumed if you saw a physical therapist, you either had surgery or you're in the hospital for something, right? It wasn't really a thing that you sort of just went to, for your aches and pains. That probably was someone you went to a chiropractor for. Yeah. So, part of that is probably us sort of infringing on chiropractic turf for a little bit, which I'm sure they're not all that enthused about, I can expect. Yeah. But then again, you've also seen that reflexive move of more chiros doing more exercise-based movement, because the research would suggest that's the most appropriate thing to do. And I think that's what more people are looking for now, right?
Yeah.
So I think that's probably more of the big culprit, is how these professions have sort of morphed over the last 15 to 20 years.
So in some ways, it's almost like you guys are helping one another evolve, right?
Sure, if you want to say that, Dan, that sounds fine.
Yeah.
No, I'm being cheeky. No, I think anything that challenges your notion of what's best care is always appropriate. You know, the day you think you know everything you need to know about being a provider is the day you should retire. You should always challenge it.
Yeah.
And whatever that looks like. And so, you know, if I see, again, I mentioned like Instagram, if I see folks on Instagram doing different techniques, if I look at one and go, oh, that's interesting, let me explore that. I might decide it's garbage.
Yeah.
I might decide, hey, actually, it might be worth investigating. But it's always worth being challenged. It's the folks who do the same stuff now that they did in 1993 are the folks I should be worried about.
Yeah, absolutely. And to be fair, also about, you mentioned the Instagram thing. Like, I haven't seen many things physical therapists do on Instagram or YouTube that have made me go. Where I have seen some videos with chiropractors where it's I saw this one in particular. I just couldn't help but show a bunch of people, but it was like, I think it was India or something, but it was chiropractics, and he was adjusting the woman's coccyx, tailbone. It was very interesting to just watch a woman lying on her back with her like legs up and kind of just going in there.
The way I learned that, you have to go in through the rectum to get the coccyx manipulated too. So because it curls forward, it curls anteriorly, so you have to get at it. Whoa. I've never done the technique. It's been described to me. Some of my colleagues have done. I have not done it myself personally. Can I share a pet peeve?
Yeah, please.
So and I think, you know, I see more PTs on there. I think they run more like, I see more humor content and like just different exercise ideas. The mic'd up manipulations and then sort of like the walk away like you just drew someone's card out of behind their ear drives me crazy. It's like, you're not curing cancer.
It's like a parlor trick kind of.
It's exactly like
in that context.
In that context, it's let's give the reality of what we're doing here. It's we're not like relocating something. It's just one thing, but it's just like, look at what I have created. It's like, just chill out.
Just like you said, just
just chill out a little bit.
Yeah,
just chill out. It's just a manipulation. It's just the thing. People, you know, I sat next to a kid in high school who used to do this to himself all the time and crack his neck. Please don't do that.
Yeah.
Because you could, you know, tear your vertebral artery and kill yourself. So don't do that.
Could you imagine how crazy that would be? You're in high school and someone just goes.
Oh yeah, this kid next to me did it all the time. He did it all the time, and maybe that's what sowed the seeds.
James Bonds themselves,
basically. Right. Yeah, it's what sowed the seeds for me being a PT now. But no, I mean that's a real risk. Like I think people kind of joke around manipulations, but like they do carry risk. Like you can't hurt or kill someone, you know, especially in the neck. I mean, the big one you get concerned about is what's called a vertebral artery dissection. So vertebral artery runs off of your iliac arch and actually goes kind of in. There's a space in the sides of the vertebrae of your neck. Okay. That artery comes up and then it sort of takes a backward turn and goes up into your brainstem.
Okay.
And there's one on each side, supplies blood flow to your brain.
Yeah.
And so when you do these traction manipulations like this on the lengthened side, you could theoretically rupture that. And that has happened before.
Wow.
So you got to screen those people to make sure and put them in those positions to make sure you're not reproducing symptoms or signs of that there's some impedance of blood flow to the brain before you go do those techniques.
Yeah. And again, to kind of give an attaboy to some of the better chiropractors I've worked with, including Brady. When in my past, I've worked with the chiropractor where it's like, right, where I get that neck crack. And the better ones, I would say, are the ones where it's way more subtle, right? Where it's maybe one click. Sometimes it's not a click, right? Yeah. It's just, you can tell that they're trying to be very specific about where they're targeting, as opposed to kind of maybe to your point, a little bit of the show of it, right? Yeah. And would you say that's true, that less is more when it comes to that?
Yes, exactly. And I think part of it is I recall this study from my past. I can't remember what it was. Forgive me for speaking a little blindly. But when they were talking about the specificity of a technique, like if say, okay, I see a dysfunction at C5-6, I'm going to manipulate this joint, close it down. When they've done the manipulation, what they've discovered is that the most motion that occurs in the spine could be 3 or 4 segments away from where your target is. So to your point, if I'm being really specific and trying to be really thoughtful about applying my force here to create that thrust, the standard deviation of where my force might go is about yay much up and down, right? If I'm doing a really big general technique where I take your head and snap it like this, that's a lot of moving joints.
It
could be anywhere, right? Yeah. And so that's why I think
indiscriminate.
That's right. So, I mean, a lot of the techniques I learned are actually a bit more osteopathic in nature versus chiropractic, which are a bit more subtle, more specific.
Okay, could you define osteopathic?
Yeah, so I mean, like a DO, if you heard of a DO, that's a doctor of osteopathic medicine. So it's, those folks have a lot of similar, rights and privileges as MDs do, essentially. But there is this element of different joint techniques that they sort of learn in the osteopathic medicine tree, I would say. And so it's just a difference in, again, how you apply force and stretch the spine and joints, that sort of thing. So the training I went through is more of an osteopathic approach, which usually is like when I manipulate the neck, it's a lot more here versus that. That's just what I learned, basically.
Yeah.
You know, and then I was just looking at something last week about the placement of manipulations and like what's better for you, and they were comparing a specific joint, a spine manipulation at a level, just a generalized kind of crack of the spine.
Yeah.
I didn't really find a lot of difference.
Yeah.
Right. So again, I don't think we need to be so worked up over, you know, where we're doing the technique and like getting it perfect. I think as long as you're applying it safely, you know, I think people will get benefit from it because, you know, again, how much are we really affecting change here versus how much are we sort of, you know, putting in a patient's head and permitting them to feel comfortable moving?
Yeah.
Like what's the goal here? And I would argue the latter point, which is that you've now put someone in a position where they feel better moving.
Yeah.
That's really, I think, the end goal that's going to get people where they need to go.
Yeah. Yeah. And again, like bringing it kind of full circle to what you were talking about earlier, it's not as necessarily as much about being perfectly aligned as it is saying, hey, this frozen vertebrae or whatever part of that vertebral segment is frozen or inhibited, that's objectively not a positive thing, right? It's meant to articulate and move alongside all the other. So if you can just get more movement in there,
right?
Again, that feels pretty objective just to say that that's going to improve something,
right? And
right?
I can get that movement without having to make the noise. You know, one of my instructors once told me, he said, it doesn't, when you manipulate a joint, it doesn't have to make the noise every time.
Yeah.
If it never makes the noise, you're doing it wrong.
Interesting.
But like, as long as you can appreciate better movement after you do a technique, just because it doesn't go in that nice satisfactory method, you're still getting some benefit there.
So in that particular instance, would you say it's good to have a sort of before and after sort of benchmark movement?
Oh, always.
Right?
Always.
Let's say you're doing this and it's kind of locked up, and then you do something in the thoracic spine, and then you go, meaning your upper back.
Yeah.
And then, I'm moving a little bit better.
Yeah.
So that, again, you're trying to stay more objective.
Well, I know you guys all document with your clients, right? And so when you document someone's strength is here, their 1 rep max at a bench press is here, and then after 4 weeks it's there.
Yeah.
You've shown that you've been effective, and more importantly, you've shown your client
that
it's been effective. Like, look at the work you put in.
Yeah.
Look how much progress you've made.
Exactly.
The same thing. If I have someone sitting at a table and they can only flex their shoulder up 130 degrees, and I mobilize, glenohumeral, collarbone, upper thoracic manipulation, and suddenly they're here, they go, holy crap.
Yeah.
Look how great that is.
That's pretty
Let's
awesome.
get on the foam roller now. Let's get moving. Right?
Yeah.
Like, it sort of justifies kind of why this technique is necessary. But again, put in the work.
Yeah.
Let's get there.
So that's a good segue into another thing I wanted to ask you. So I consider personal training not necessarily to be physical medicine, but maybe if it was in that category, it'd be the proactive piece of it.
Yeah.
Right?
Yeah, absolutely.
Where you've already been addressed by a physical therapist or a chiropractor or whoever, right, to be ready for exercise. And then you can take that and build upon it, right?
Yep.
And see some of the benefits that, of course, are, again, irrefutably beneficial, like building muscle and strength and bone density, et cetera, right? And so other forms of physical medicine like acupuncture, massage, those are two that come to mind and quickly for me, right? In your assessment, where do those, so Dr. Joe has his perfect scenario of how he can use other forms of physical medicine while he is the sort of overseer, right? They're going to their PT as the one who's kind of their
sitting on my
liaison.
golden throne,
yes.
overseeing all my...
yes, exactly. So you are the king of the castle in this case, right?
Oh, yeah, I love it. I think, massage is pretty tried and true for what it provides for folks, right? It's eliminating soft tissue barriers to allow for better mobility. So I always describe muscle spasm to patients as a symptom rather than a diagnosis, right? Like, people don't get diagnosed with a muscle spasm because it's your body's reflexive response to something else. And so oftentimes the something else is what therapy is for.
Yeah.
But, if I've worked at places that have massage therapists on staff, and selfishly, if I could, I do a lot of massage on my own. Well, I call it manual therapy because it doesn't feel as good as massage does. But, I do a lot of it myself to kind of try to loosen a little bit of soft tissue restriction. Before I do all my other techniques. But if I have a massage therapist who could do that first, then it makes my job a little easier.
Yeah, or maybe in a case where it's really wound up.
Yes.
Right. And it may be good to kind of get momentum on your side. Maybe not the best use of Dr. Joe's time to just take multiple sessions for an hour or whatever it is every time.
Yeah.
Hey, between now and the next time, I want you to continue to get loosened up 3-4 days from now until I see you again. Right.
Yeah. Yeah. And I've certainly told my patients, if you want to go see one, a massage therapist, once a month, once every 2 weeks, whatever kind of fits your budget and your time, that's great. I think some folks just take an hour themselves for a little bit of quiet. Not the worst thing in the world,
Not
right?
at all.
So
Not at all.
there's some other effects other than just the physiologic massage, effects of massage. Acupuncture is a little trickier because there's some more concepts that aren't really taught in Western medicine.
Okay.
So what I tell folks is it's been around for thousands of years, right? So there's some efficacy there, and when they've looked at with Eastern medicine, they call meridian points, and Western medicine trigger points. What did I read? There's like a 71% correlation between those two things. So there's some overlap there between what we would associate as like something that we would address with, say, dry needling, which is what I do, or a lot of therapists do, chiros.
Yeah.
Some chiros do acupuncture. And, what an acupuncturist might do.
Yeah.
Now, if someone comes to me for low back pain and I elect to dry needle them, I might dry needle their psoas or their quadratus lumborum or a multifidi muscle.
Yeah.
Eastern medicine meridian points for low back pain, there's one here and there's one here.
Interesting.
And so it's tough for me as a provider in Western medicine to tell a patient, hey, your back hurts. I'm going to take this needle and stick it in your face.
Yeah.
That stuff sells. Right?
Yeah.
But that's just kind of commonplace in that medicine. So I'm not as equipped to talk about that because I don't know that medicine as well.
Yeah.
I've had folks who love it. I've had folks who got one needle and said nope, and they eat it out of there. So it just kind of depends on the person.
Okay.
So I don't go out of my way to recommend acupuncture. If someone wants to go,
Did you say you eat it out of here?
I did. I'm hip.
You are
I'm hip.
You are
Heck
hip,
yeah, man. I give these high schoolers keep me young. I did have one sort of refresh remember what touch grass meant because I thought I knew, and then my 13-year-old patient said it differently.
Deco touch grass, do you know?
I think so.
Yeah, it means get offline, go, ground yourself. Yeah. Okay, perfect. See, we'll teach you.
Oh, so it's not like a get bent kind of thing. It's more like you need to get grounded.
Like kick rocks. Have you heard
kick rocks?
Isn't that an old saying though? Isn't kick rocks kind of old?
That I see
Pound
pound
sand, right?
God dang, we're old. Okay, anyway, moving on. But if someone wants to get acupuncture, the only thing I recommend to them is that they make sure that they go find someone who actually went to China and got their doctor of Chinese medicine. Because there's those folks, and there's folks who just open up in a strip mall and have some needles and want to play.
Yeah.
So if you want to go, I just make sure to go to someone who's reputable. Like when I took my dry needling course, my first lab partner was a doctor of Chinese medicine. And she was excellent, and she wanted to learn about this course of treatment.
Awesome.
Great for me since I faint with needles. So having my first lab partner who had an extremely steady hand made my experience a lot better.
Yeah.
So that's my only caveat. I don't tell people not to go.
Yeah.
Because again, it's I can't speak to the many years of its tradition. I don't go out of my way to because there's not so much to say, oh, you have to go and get this.
Yeah.
But that's my only caveat. If you want to go, just at least do a little bit of research.
Awesome.
Yeah.
Well, Dr. Joe, thank you so much for coming on today, dude.
Of course.
Every time you're here, I learn so much, and it's awesome.
Thanks, man.
So I'm so grateful to have you on. And
yeah, thanks for letting me share. Appreciate it.